compared the state results, we just have a higher level of alcohol substance abuse issues than the state in this area in general. So that's why we receive funding to work on what we do, is because we're higher than state average based on our survey results.
I think I read somewhere in your information here that out of the 87 counties, we're falling usually in the second or third position.
Yes, unfortunately, we have received funding for the Minnesota Department of Public Safety Office of Traffic Safety every year since I've been the coordinator. I began in 2006, and I know the grant started up here in 2003, and every year we've been 2 or 3 on the list. I just looked at our 2012 numbers before coming on here, and we're actually, I think, 4th or 5th. We're tied with a bunch of counties. So we are seeing some improvement, but we are notoriously higher in this region for alcohol-related traffic deaths.
Sad statistic for sure.
Yes, yes, and we've been working really hard trying to get our numbers down, and it all comes into play, you know, just how important this issue is, no matter what the age, because it all impacts our statistics and, you know, our community.
For sure.
And our people here, so it's important.
Let's talk a little bit now. We've kind of laid out the issue pretty well. What are some of the strategies that you're working on to try to reduce that? Sure.
Well, Mesabi Safe Communities Coalition actually works on a lot of traffic-related issues. So, for instance, right now it's holiday time. So we support our law enforcement with our campaigns. So the health educator that works for me will be going out and distributing the window clings and the coasters to the area bars.
Oh.
And this changes depending on what campaign we're going on. But this is our December campaign. It actually starts this weekend for Thanksgiving. So
these are the things that you put your drinks on?
Yep.
Oh.
Yep. So yeah,
it's right
you
in
could
front of
put your
people.
mug right there. Yeah. Reminding people that law enforcement are out on the highways in bigger numbers looking for impaired drivers. So that will start this weekend with Thanksgiving. We tend to have fatalities this time of the year. So unfortunately, you know, they occur. So we're just trying to remind people, you know, if you're going to drink, please designate a sober driver or don't drive. You know, stay where you're drinking. If you can crash on the couch, we'd rather have you crash on the couch than on the road.
For sure.
So that, you know, that is one of the things we're working on with Mesabi Safe. We also will be working on a sober cab program called Joy Ride. We were hoping to get it started for Thanksgiving. It just didn't come together. But we are trying to get it started for Christmas or New Year. So we want to pilot a non-busy weekend just to get kinks out. But we're hoping we get that started next month. So that will help with some of the traffic issues too. Because we know people want to go out and celebrate. And sometimes alcohol does fuzz the brain up and they do get in their cars. So we're trying to do a multi-prong approach onto reducing our traffic deaths with Mesabi Safe Communities Coalition. So
that's a laudable goal for sure.
Yes, yes.
What other things are you working on as far as strategies? Are there other tactics that you're taking?
Well, with the Chemical Health Coalition around substance abuse, we just received our community survey results, and we are actually working on a social marketing media campaign. So we're going to be taking a look at our data and try to look at messaging that will help us change the norms in our community. When you talk to people that aren't from the range and you say, I live on the Iron Range, they're like, oh, you guys know how to drink, you know, and we want to, you know, get rid of that. Everybody in their communities, you know, alcohol is part of the community. We just don't really want to be known for that. We want to make our communities known for iron or hockey. We want to change that Iron Range, you know, perception that's out there in the rest of the state. So we'll be working on that. We are also implemented alcohol EDU in the high schools, in the college, Hibbing Community College, and that is an alcohol prevention curriculum that's taking place. So that's new this year. That's part of the grant. So we'll be evaluating the results when that is done as well. We are working on trying to reduce youth access to alcohol at community events, and we will continue to do that. We know that people, again, want to have fun and participate in events. We just want to make it a safe place for our youth so they're not getting access to alcohol at those events. So we're trying to partner and continue to work on that. We also have a youth group in our school. We have one at the high school, and we have one in the elementary school for our 6th graders that is called TADA, or Teens Against Alcohol and Drugs. So that is going on. And we are working on a Zero Adult Provider Committee that would look at actually going after the providers of alcohol. We have our social host ordinance that goes after people that provide a place for underage to drink, but we want to look at how are those underage drinkers getting their alcohol, who is actually providing it to them. So there is a strategy statewide called ZAP that we are going to be implementing in Hibbing. So just a bunch of different strategies in the near future that we'll be working on.
You know, I think something worth talking about a little bit is that I think there's been some misinterpretation by some community members that what your group is about alcohol prohibition. Mm-hmm. And my interpretation is it has nothing to do with alcohol prohibition. It has to do with being smart about mm-hmm. alcohol use and being legal.
Right. So
maybe you'd like to comment a little bit about that.
Right. Well, if you look at alcohol, it is a legal substance. And, prohibition has been tried and it's failed. What we find, and, the new research, and I'm always, going to classes and learning more, but the new research on the developing brain with adolescents is teens don't really have their frontal lobe fully developed until they're 25. So anybody that's ever had a child and raised a child to adulthood can kind of see that. Their frontal lobe is their decision-making part of their brain. And it doesn't develop till they're 24, 25. So what research has also found is that if you have a child that starts drinking before the age of 21 or using a chemical before the age of 21, it changes the brain chemistry. And they are finding that those children have like 4 to 6 times more likelihood of being addicted to alcohol or drugs than if they would have waited till they were 21. So we're trying, because we do have a high rate of substance abuse issues and problems up here, that we're trying to make a difference there. So yes, we're not fun haters. I actually do enjoy an alcoholic beverage, but what we're trying to do again is to keep it out of the hands of our youth and keep them safe. And that's what we've been working on. We're not trying to shut anything down. We're just trying to have control and actually help our law enforcement maintain control of certain events in our community.
Sounds reasonable.
Yeah, well, thanks for asking that.
Sure. I don't know if you know the answer to this, but one of the questions I get asked a lot mm-hmm. is with all the media attention in Duluth recently with the synthetic drugs mm-hmm. and those types of things, are we seeing a resurgence or an increased amount of that use in our area here too? Are you aware? Well,
we had synthetic use problems here. We had a couple of places that were selling synthetics. They have since stopped, which is very, very good. We do know that we have community members, children of people that I know that still use synthetics. Because they can get it, now that Duluth is shut down, there are still places they can get it on the range or online. Mm-hmm. So that is still an issue. We're actually starting to hear of people youth using heroin and some meth starting up again. So they're just, you know, you try to work on one thing and something else pops up. Substance abuse is just, it's a really hard issue to work on. And, you know, something that we try to stay focused, but alcohol causes more problems, you know, statewide, nationwide, than any other chemical, whether it's legal or not. Alcohol, you know, hits every social and economic status, every age, you know. So it's really an issue that we're trying to focus on. Because it is legal, it's a little harder
Sure.
to curtail the tragedies that come from it sometimes.
Sure. So I know you mentioned this earlier, but maybe one more time you want to talk about if there's someone who's interested in being involved with the work that you're doing or the coalitions, how do they go about doing that?
Sure. So they can either contact myself, and my work number is 312, which is local Hibbing number, 312-3012. Otherwise, like I said, both of our groups are on Facebook, and you can find the link through our Fairview Range website under Community Health. They're linked there. Or they can email. Or if they know a community member that is on our coalition, just, you know, let them know, and, you know, we can add them. Anybody, we don't discriminate. Anybody's welcome to join both of our committees.
Wonderful.
And we welcome them, actually. So,
Thank you.
Mm-hmm.
So Cheryl, our time's about up. Anything that we haven't touched on today that you'd like our viewers to be aware of?
You know, I think we've hit a lot of things. Just, you know, it's a holiday season right now, and I know, you know, this might not air for the holidays, but, you know, this issue is something, when I talk about community health, I always say it takes a community to raise a child, and it can't be done just with parents alone. It takes the schools, it takes the parents, it takes law enforcement, it takes the hospital. So just, you know, if we can all work together on raising our children so they grow up to be healthy and chemical free, that would be great. So
It's a good message to leave with.
well, thank you.
Well, that's our show for this month. We thank you, Cheryl, for taking your time and bringing forth information on this really important community topic, and good luck with all your work on that.
Thank you.
If you have a topic that you'd like us to speak to, we're always interested in meeting the needs of our community. You can give us a call at 362-6771, and we'll see what we can do to honor your requests. Thank you so much for watching today, and we hope that you enjoyed this session of the Fairview Range Focus.